The World Health Organization, WHO, declared on Wednesday that the growing spread of mpox in Africa is a global health emergency, warning that the virus could potentially spread beyond the continent. WHO Director General Tedros Adhanom Ghebreyesus made the announcement following a meeting of the UN Health Agency's Emergency Committee. On Tuesday, the Africa Centers for Disease Control and Prevention, Africa CDC, had already declared mpox a public health emergency across the continent. According to WHO, Africa has reported over 14,000 mpox cases and 524 deaths this year, surpassing the total figures from the previous year. Notably, more than 96% of the cases and deaths have occurred in a single country, the Democratic Republic of Congo. There is growing concern among scientists about a new variant of the virus spreading in Congo that could be more easily transmitted among humans. Understanding mpox. Mpox, previously known as monkeypox, was first identified in 1958 during outbreaks of a pox-like illness in monkeys. For many years, most human cases were confined to Central and West Africa, primarily affecting people who had close contact with infected animals. However, in 2022, the virus was confirmed to spread via sexual contact, leading to outbreaks in over 70 countries that had never previously reported mpox. Mpox belongs to the same virus family as smallpox but generally causes milder symptoms, including fever, chills, and body aches. Severe cases can lead to lesions on the face, hands, chest, and genitals. The situation in Africa. The situation in Africa has worsened significantly, with the Africa CDC recently reporting that mpox has been detected in at least 13 African countries. Compared to the same period last year, cases have surged by 160%, while deaths have increased by 19%. Earlier this year, a new strain of mpox was identified in a mining town in Congo. This strain has the potential to kill up to 10% of those infected and may spread more easily than previous variants. Unlike past outbreaks, where lesions were primarily found on the chest, hands, and feet, this new strain causes milder symptoms with lesions on the genitals, making it harder to detect. This means that infected individuals may unknowingly transmit the virus to others. WHO also reported that mpox has recently been identified in 4 East African countries, Burundi, Kenya, Rwanda, and Uganda, all of which have linked their outbreaks to the epidemic in Congo. Tedros expressed concern about the further spread of the disease both within Africa and internationally. In contrast, Ivory Coast and South Africa have reported outbreaks of a different, less dangerous strain of mpox that was responsible for the global outbreak in 2022. Implications of the emergency declaration. WHO's declaration of a global health emergency is intended to prompt donor agencies and countries to take action. However, the response to previous declarations has often been mixed. Africa CDC Director General Dr. Jean Casey stated that their declaration of a public health emergency aims to mobilize our institutions, our collective will, and our resources to act swiftly and decisively. He also appealed to international partners for assistance, noting that the escalating cases in Africa have largely been overlooked. Michael Marks, a professor of medicine at the London School of Hygiene and Tropical Medicine, emphasized that current control strategies are insufficient, highlighting the urgent need for more resources. He suggested that a global emergency declaration could be a necessary step to unlock these resources. Differences in the current outbreak. The global mpox outbreak in 2022 primarily affected gay and bisexual men, with the virus mainly spreading through close contact, including sexual activity. While similar patterns have been observed in Africa, children under 15 now account for more than 70% of the mpox cases and 85% of the deaths in Congo. Tedros pointed out that the current situation involves multiple mpox outbreaks in various countries, each with different modes of transmission and risk levels. He stressed the need for a tailored and comprehensive response to stop these outbreaks. Save the Children's Congo director, Greg Graham, expressed concern about the spread of mpox in overcrowded refugee camps in the east of the country, where 345,000 children are living in unsanitary conditions. He noted that Congo's health system is already strained by other health crises, including malnutrition, measles, and cholera. Dr. Bogoma Titanji, an infectious diseases expert at Emory University, remarked that it is unclear why children are disproportionately affected by mpox in Congo. She suggested that it could be due to children's increased susceptibility to the virus or social factors such as overcrowding and exposure to infected parents. Strategies for containment. The 2022 mpox outbreak in numerous countries was largely controlled through vaccination, treatments, and public awareness campaigns that encouraged people to avoid risky behaviors. However, in Africa, there has been limited access to vaccines and treatments. Marks from the London School of Hygiene and Tropical Medicine noted that vaccination would likely be beneficial, particularly through immunizing people against smallpox, a related virus. He called for a large supply of vaccines to be made available, especially for high-risk populations such as sex workers, children, and adults living in outbreak regions. Congo has reportedly begun discussions with donors about possible vaccine donations and has received some financial aid from Britain and the United States. WHO has allocated $1.45 million from its emergency fund to support the response to mpox in Africa, but has indicated that an initial $15 million is needed to adequately fund the response.